Well, welcome back. So I think we're going to organize our next panel around a number of questions that I tried to throw into the mix, and at least from conversations I've had with people in break, it seems like questions that they have as well. We are going to talk about social impact, what that is, how we measure it, and I hope we have enough time to talk about what it means to scale that up. And we have, I think, a very interesting panel today. On my left is Stuart Donaldson, who comes from Claremont Graduate University. He's a dean there of, actually, I think 3 schools. Is that correct? 2 schools, sorry. and the director of the Claremont Evaluation Center. Claremont runs the largest training program for evaluators in the world in terms of master's and PhD students. And he has been an evaluator for quite a long time and is the past president of the American Evaluation Association. So we're very honored to have him with us today. And Jocelyn Corbett from B Labs. And you're probably familiar with B Labs as the folks who are involved with B Corps and with trying to help organizations do more good. Is that a good description? We have Robin Miller, who comes from Michigan State University. And she is a past editor of the American Journal of Evaluation. You may be shocked to find that evaluators have journals. AEA has 2, that and also New Directions for Evaluation. And she is a well-known evaluator in our field and has spent a lot of her time working with in the field of HIV and AIDS prevention and working with very difficult to work with, well, not work with, defined groups, yes. Yeah, thank you. And we have Carmelo Barbaro from Urban Lab. We have 2 labs here, so it's almost somewhat scientific, I think. Measuring impact and trying to create more good. So I'm going to open it up first by having each of them tell us a little bit about what they do, and then we'll ask some questions, and we'll have you ask some questions, and we'll move it on from there. Carmelo, why don't we start with you?
Sure, and thank you. I'm so excited to be here. So I'm Carmelo Barbaro. I'm the executive director of the Poverty Lab, which is one of the urban labs at the University of Chicago. So the urban labs are a practitioner-driven research institute focused on working with nonprofit organizations, policymakers to do research that makes cities a better place to live. So we work really closely with policymakers to try to understand, and nonprofit managers to understand questions that they have that would allow them to have more of an impact, and we had designed research studies and analyses to answer those questions. Quite often this takes the form of impact evaluations for organizations that are delivering services or that have designed a new product that is meant to make life better for city dwellers. And our close partnership with government organizations allows us to use a lot of government data to accomplish that, which I'll elaborate more on later. But I think very excited to be here.
Hi, I'm also very pleased to be here. My work is largely done by me as an individual with teams of other people, but I work mostly on contract, and my evaluations range in scale from very small evaluations working with a single not-for-profit organization or a community that's trying to organize to address HIV issues locally, all the way out to issues or innovations that are national in scale, both here and in the Eastern Caribbean. My career has focused almost exclusively on the issues and concerns of sexual minority men of color, and in particular, teenagers. So working in a very distinct ethical and legal space since the mid-1980s, evaluating those kinds of programs and projects.
Hi there, Jocelyn Corbett with B Lab. We are the nonprofit behind Certified B Corporations. I run the West Coast community of Certified B Corporations. And our certification is unique in that we're not measuring a product or a building, we're measuring the entire company. And we look at the governance structure of the company's impact on its community, environment, and on workers. and I'll get into a little bit more about what exactly we do later on.
Good morning. I'm Stuart Donaldson. I, as John said, wear a lot of different hats. I both run a number of academic programs. And so one of the things I'm especially excited about is this campus up here in San Francisco, because we're in the process of a LA campus and a Washington, DC campus. And this looks like a real model to me of, doing sort of good, solid education away from the home base. So it's been really nice to talk with you and see that side. I'm going to focus today on the Claremont Evaluation Center, where we train graduate students in applied research and evaluation. And we've worked with hundreds of organizations trying to fit the latest approaches to evaluation to the sort of needs of specific organizations. So when we're working with a very large corporation or the government, we use different approaches than when working with a social enterprise or a community-based organization. And so I hope to talk a little bit about the work that we're doing around trying to evaluate impact.
So as you can see, our four panelists cover very different parts of the social impact space. And so I'd like to start by asking them what social impact means in their professional context. And to think about that, if it's possible, not in terms of how it's measured, but what it means in that context. So let me start over here with Stuart, and we'll work our way back.
Okay. So my job is to reinforce some of the ideas that John said in his keynote, because we actually work together. And as of course, I was the president last year, and now as the has-been, he's bringing me along to some really neat conferences like this one, so I have to be nice. But to simplify, I think when we think about impact, we're really thinking about the value added of an intervention. And as John said, interventions come in all kinds of shapes and sizes, but at the end of the day, what is the value added? To get beneath the surface of that, we are usually looking at a collection of outcomes. And those in some way, add up, or, we sum those up. What doesn't get looked at enough when we work with organizations that are trying to have a very positive impact on the world is the potential negative effects of interventions. And whenever we think about total impact, and I'm going to now put it into social impact, we want to be thinking about both the positive impacts and those that are intended. So there's a set of outcomes that we might look at there. But then there's also unintended impact that a program can have, both positive and negative. So at the highest level, impact is trying to put that complexity together and try to determine the value added of a particular intervention.
Jocelyn?
I really appreciate this question. I think it's incredibly helpful for us to step back and define what we're talking about. And I encourage you all to think through your personal definitions of impact, because I hadn't ever been asked this question before. So at B-Lab, our context is within for-profit institutions. And so we look at, or we would define impact as the effects, both positive and negative, of a for-profit institution on their stakeholders. And that would be our clear definition. Our origins are kind of from the acknowledgement and wanting to elevate the fact that for-profit companies, when their sole focus is on maximizing shareholder profit, have more reign to have considerable negative impacts on their stakeholders. And so our focus is then on creating an alternative. On measuring positive impacts companies can have on their stakeholders, on creating a movement of people using business as a force for good to elevate this alternative, and then creating an alternative legal structure to protect directors in pursuing or in considering rather their stakeholders as they make key business decisions. So yeah, I'll leave it at that.
This was a challenging question to answer in some sense because I work in a space where there are multiple communities that do not necessarily respect or interact with one another, each of whom would answer the question quite differently from the position where they stand. If they were physicians, they would give you a different answer than if they were activists in the Castro. So my job as an evaluator is to stand in the middle of those spaces. So the answer I'm going to give you is my answer, not theirs, but it's one that tries to cut across where I think the field is at this point, internationally and domestically. And so my answer is a two-part answer. One of the things I think we're looking for is whether or not innovations have an effect on existing disparities. Part of the reason that becomes important is there are many of interventions that are intended to lift all boats, but lift only the ones that have the fewest leaks. So they increase the gap between the people who are currently disenfranchised and bear the excess burden of HIV disease around the world and those who are able to take advantage of the innovation that's offered to them. So for me, impact means that you actually do something that reduces the extent to which these health disparities that are persistent and stubborn and everywhere you look around the world, whether you do something to make that disparity smaller. The second thing, and I think it's a shift that reflects the understanding around the complexity of public health issues and diseases. And there's a concept we use now that's called a syndemic, which refers to the notion that epidemics don't exist in isolation, that you see syndromes or clusters of epidemics concentrated in particular places. And the presence of one makes the others worse. Right? You don't see HIV by itself, you see it alongside abuse, syphilis, and a variety of other kinds of issues. The drivers of those syndrome of epidemics may be the same. So the other way in which we now think of impact in my field has to do with this notion of creating what I'm going to call, for lack of a better term, competent communities. Communities that are competent to manage their public health epidemics and the changes in those epidemics over time. So there's a real shift in thinking about this as stuff that has to do with the behaviors of individual person and how they move about on a day-to-day basis in the world and the agency that they have over their health. To think about it in terms of the responsibility we have to build a community infrastructure that protects the public health of all citizens and does so equally so everyone has a fair chance of living out to the natural end of their life.
Thank you.
And I'll echo several points that have been made, I think, in the last couple minutes, but also in John's keynote this morning. So I think for us at the Urban Labs, as I mentioned earlier, the goal is to identify programs, interventions that make cities better with a focus on the most disadvantaged residents of cities. But because we start with the individual program, as any evaluator would, the outcome varies from program to program. So when we're studying a program that provides academic, financial, and professional supports to low-income community college students, the outcome that organization is interested in is a graduation rate, right? It's quite straightforward. When we're working with an organization that is trying to help low-income households conserve energy and improve their on-time bill payment, the outcomes there might be total carbon emissions, and they might be sort of money saved over sort of their maybe prior experience with energy consumption. So I think the outcomes vary. I think for us, the mission is clear, and I think the method is important. So we're really focused on causal impact. We do the largest share of our portfolio work is randomized controlled trials. And so our goal is really to confirm in as many cases as possible that it was that specific intervention that drove the difference that we're seeing in outcomes. So for us, within my context, that is almost the most important component. We really want the nonprofit sector and the public sector to be thinking about causal impact specifically.
So a range of perspectives. And I want to shift from the conceptual definition to the practical side. All right, so if you have some view of what matters to you in terms of impact, how do you go about getting a handle on it in practical sense? How do you measure that? How do you describe it? How do you make sense of it? So maybe we'll start with you, Jocelyn, and work our way through you.
Yeah, so importantly, when we were talking about this beforehand, John had said, first, why are you measuring what you're measuring? And B-Lab's vision is a shared and durable prosperity, full stop. And our theory of change is that we shine a light on the leaders and companies who are doing it right, who are creating positive benefit, and then we create a pathway for other companies to follow. And so the brass tacks, that's the why, essentially. How do we get towards a shared and durable prosperity? And the what is an assessment. Actually, before I continue, how many people are familiar with B Corp certification? Great, cool. So I'll get into a little more detail. It's a self-assessment that companies take. You have to score a minimum of 80 out of 200 points. To put that in perspective, 30,000 companies have taken the assessment, and we have currently 1,650 B corporations, so it's a high bar. And we have B Corps across 130 different industries now in 47 different countries. And so our whole focus is what's a somewhat standardized unit of measurement for companies so that consumers, partners, cities can know what a good company might look like. And importantly, I want to acknowledge that our assessment is not perfect. We reiterate and revise every 2 years and have a wide open feedback door policy. There are constantly new industries that are cropping up, for example, the sharing economy, right? Or there are new best practices that are coming to the fore. The work of important folks like Poverty Labs might be showing us best practices that we need to incorporate. And so that's one of the, where one of the limitations of our assessment is that because we're measuring across broad categories, we're not going as deep as some of the other certifications. I would say one of the benefits is one that we're measuring across, right? So we can kind of come up with a conception of what a good company is, but also that we're constantly evolving. And our assessment, I think, is humble.
I should just say that a lot of what I study is not the best practice. It's what happens to the best practice when ordinary people try to do it, because those are different things. So when Carmelo does the efficacy study, or what we call it, to figure out what's the best way to solve the problem, a really tight, rigorous study, and then that gets somehow passed out into the world, I do the what happens after that piece of the puzzle and look at effectiveness and how ordinary folks manage with some of these kinds of evidence-based ideas and best practices. There's a big gap between the two things typically. But I would say, because of the nature of what I study, the range of things that we tend to look at is pretty broad. It's clearly project specific, but it usually incorporates a mixture of biological indicators. So I do look at things like whether or not a person's viral load, which is how you tell if the level of HIV in their body is actually likely to make them ill or put them in a position of transmitting HIV to other people, whether their viral load levels are low enough that it's an indicator they're taking their medications, which is an indicator that the quality of care they're receiving is adequate, and that they're following whatever that medical care system's prescriptions are. So I will use measures like that. I use measures of actual HIV test results. So it's one thing to have an app that is supposed to encourage HIV testing, and it could be really cool. But if everyone who takes an HIV test as a consequence of your app tests negative, then you're not reaching high-risk people who need to be in care. So I actually look at things such as whether the test results that are generated by your app are bringing up high rates of new positives, because then you're getting places where that app needs to be. I also look at ranges of things that are more in the behavioral realm as well as the psychological realm, and I do that both at the level of individual people, but also at the level of systems. If you're building a community infrastructure that works, part of what you want to understand is how actors in that community relate to one another, whether you're building ties that didn't exist before. So for example, in the public health system, the people who test for HIV may have nothing to do with the people who treat, or the people who deal with housing issues, or the people who deal with transportation issues. They may not have any interaction with mental health providers who deal with things such as PTSD or recovery from sexual assault trauma. So looking at social networks in the infrastructure of public health can be an impact for me, because it's a way to understand whether you're creating those kinds of bridging relationships. Just as on the panel before, we were talking about trying to create bridging relationships between breast cancer patients, people who do breast cancer research, and potentially, hopefully, the people who actually care for those women. So that can be a measure of impact for me.
So as I mentioned earlier, the specific outcomes that we're trying to measure, what we're trying to quantify, varies project by project. But I think something that has enabled us to do some really interesting work at a relatively low cost for this type of work is that we try to do it as often as possible using government administrative data. So we have really great relationships at the Urban Labs with several local governments that allow us to use really sensitive data to do our research, such as Chicago Police Department arrest records, Chicago Public School grades and attendance data, Illinois Department of Public Health emergency room discharge data, some very, very sensitive data. But what that allows us to do is when we're thinking about whether or not a program that the philanthropic sector or the public sector has invested in is having an impact on outcome measures that they care about, we can track those things at relatively low cost. So for example, we were involved in a study a few years ago, the city's summer youth employment program. So the city of Chicago hires 25,000 teenagers every summer for 6 to 8 weeks and gives them, for many of them, their very first work experience. There was this sense that giving a job to these young people would sort of help them to stay out of trouble. Maybe the work experience would be valuable to them in the long term in getting additional job experience. So we did a randomized control trial, and over the last several years have actually used police department data, unemployment insurance data to track what happened to these young people. So we were able to see things like the fact that participants were much less likely to be involved in violent crime in a very systematic way without spending a great deal of time and energy running surveys, for example, and asking people that kind of sensitive information. So I think that is a tool in our toolkit. But as I said, the specific things that we try to measure vary. I think one point, though, for us is, ultimately, our work is, in some ways, to drive decisions by policymakers and funders. And so the things that we are trying to measure tend to be the sort of final outcomes that audience is interested in. So while there might be a whole host of ways in which that job is valuable to that young person, on some level, the city's not going to spend $5 or $6 million every summer hiring young people if there isn't an impact on arrest rates, incarceration rates, and ultimate labor market outcomes, which I think makes the picture that we offer in some ways incomplete, but I think it's in the service of this sort of specific set of decisions that we're trying to inform.
Yeah, I'm going to limit my response to the social impact component of the broader impact area. And in working with the clients that we work with, and we work a lot in teams, there's a huge desire, demand for demonstrating impact, measuring impact. And I know all of you that are, either have social enterprises or thinking about, having sort of a social program of some sort, this is going to be something that drives you, because people are going to be asking you, how do you know what you're doing is having a measurable effect? The good news is, in the field today, there's a wide range of options now that you can think about with your work. There is a tension in the field about which ones of these are the best way to go, or what we sometimes call as the gold standard. So we were talking earlier about efficacy trials, where you may be in a position where you can do what we call a randomized control trial, and that could be an option for you. As I imagine the kind of work that you're doing, I would think that would not be an option very much of your time, if I've got it right from the talks and the people that I've met. So what do you do if you can't have a counterfactual and compare what you do to something else? In the field, the other approach is, I would broadly call a sort of mixed methods approach to trying to get the questions framed and the best evidence you can to make judgments about the kind of impact that you're having. And what I've done in my work is really tried to separate out, when you're trying to get evidence on projects like yours, the differences between credible evidence and actionable evidence. And a lot of the focus on measurement is, in my view, too focused on the credible component. Searching for the most credible evidence as possible. You can get credible evidence that's not actionable to what you're doing. So with actionable evidence, it's going to be evidence that may not be perfect, but will allow you to either improve your program, to scale up your program. It'll be good enough and focused enough to have you be able to make decisions and move your projects forward. Let me end by one thing that John mentioned, the compared to what question, because I think this is an easy way to think about it. So if you think of your enterprise, if you're going to be in a position where you can experiment and do an efficacy study, then the key is going to be, what are you comparing your project to? And how you pick your control group is absolutely essential, as I think John pointed out in his talk. If you're not doing that, if you're going to do a compared to what kind of study, you can establish criterion, and you compare what you're doing to some criterion ahead of time, and that doesn't require a randomized control trial. It requires another kind of methodological process. Another option, which is I see a lot of people in this space doing, is what I would consider a what is possible kind of analysis. We call this a success case method or an exemplar method. And there you're not looking at the average net effect. You're looking at what's a really nice effect, a big effect, a success case. And that can also be very effective in the kind of work that you're doing.
Okay, good, thank you. I think maybe we'll open up to questions. I think I see Hashim typing frantically, which I'm assuming is all of the questions rolling in.
We do have some.
Okay, good. Why don't we open it up to questions to our attendees? Yes.
Right, so the first one is directed to Jocelyn. What do VCs, angels, and investors in general think of B Corps, and are they more or less willing to invest?
It's a great question, and I'm sure it's on a lot of folks' minds. So let me first just be super clear. We at B Lab focus on B Corp certification. We've also supported the legal structure. Benefit corporation is the legal structure, right? And so I think the question is probably directed more towards what do VCs and investors think about legal benefit corporations. And a little more context there, benefit corp law has passed in 31 states across the United States, including Delaware, the home of corporate law. So there's education that needs to be done, quite frankly, about the benefit corp legal form. We have several companies within the Certified B Corp portfolio and the Legal Benefit Corp portfolio who have received significant traditional venture-backed capital. Alt School is one, Certified B Corp and Legal Benefit Corp, who is, has received $100 million in investment. Another company recently came to me, I can't disclose who they are, but a company that's seeking to raise $50 to $100 million within the next couple of months, and they said it's really important that we become a legal benefit corp and get our certification because we want to codify our mission before there are other hats in the ring. And so the benefit corp legal form, the way we talk about it is to protect, again, those directors and officers who want to bake the mission into the DNA of their company and have that live on forever. Patagonia, we kept trying to get Patagonia to certify as a B Corp, and it wasn't until Legal Benefit Corp form was available in California were they interested, because Yvonne Chenard said, it's really important to me that Patagonia is a mission-aligned company forever, regardless of who's at the helm, regardless of what happens when I die. And so let's codify that into our bylaws, and we'll certify too, because that allows us to improve. So to address the specific question, there is education that needs to be done. People are still wary because this is a new corporate form, right? It's a new way forward. And we're seeing more and more traditional investors who are happy to invest alongside their values, and who recognize that you're not substituting profit for purpose. You're getting both together. So within the frame of stakeholders, importantly, shareholders is a stakeholder, or are a stakeholder, right? We're not asking that you disregard shareholders entirely.
Thank you. Carmelo, how do you prove causal impact in a collective impact effort where many partners have programs that contribute to a big result?
So that is a good question, and I think it's something that we haven't figured out yet. I mean, I think most of our work has been with, with individual organizations on individual programs. So just to give a little bit of background on me, I'm a former urban planner, and so community development is something that I'm very interested in, and sort of the efforts of multiple community groups to improve a shared space. And so, since the Urban Labs was launched about a year ago, we've had a number of those types of organizations in Chicago come to us and say, hey, we're working together, we've been working together for years, help us to understand our impact. You can't do a randomized control trial of the efforts of 30 organizations over 10 years in a neighborhood. I don't know what the counterfactual to that looks like, I think. So it's something that we're sort of working to figure out. It is a case to which our most common method is not well suited.
Thank you. Robin, how do you deal with the biggest bang for your buck idea as it relates to your definition of impact? They provide an example here: fixing the issues with the least amount of leaks, easier, potentially bigger bang versus increasing the disparity.
I think you've hit on one of the biggest challenges for the HIV epidemic, because what's easiest to do, we've learned already, has the least bang for our buck. And that's really been the rub for us over the last 3 decades. It's very easy to get people in a room and give them some form of education about what they ought to do differently. It's much harder to change laws and policies and practices to support the public health. But I think the evidence is really starting to show that that's where the bang is, right? I mean, so you can look at, for example, in a study I did that actually, sloppy though it may be, it tries to deal with the issues that Carmelo was just addressing. Couldn't do an RCT, lots of actors, so we looked at contribution analysis as a way to think about that. But we would find, for example, that you could dramatically increase the rate with which kids got into care, meaning that within 40 days of getting their HIV test result, they were at a doctor's office with a simple policy change. You could get bigger effects doing something like that than you could teaching workshops all day long in every public school in the entire state of Florida. So, I mean, I think finding those kinds of policy levers really and those infrastructure levers is where the field is trying to go. We have no good answers as to how to do that yet, but I think we're clearer than we were many years ago that a lot of these issues don't sit at the feet of individuals. They're system issues, and we need to find the kinds of policy and infrastructure levers, and that's where the bang is.
So your mic is not transmitting?
It isn't. I have a big mouth, though.
All right, Stuart. What would the social enterprise need to do to ensure that using success case methodology doesn't become hand-picked narratives of successful participants that don't really speak to impact?
Okay. That's a very good question. So when you're looking at exemplars or success cases, you're answering a different question. You're not answering the question, what happens on average to the people you're trying to reach. Now, if you, in a systematic way, can't, show a good number of successes in what you're doing, that, tells you something about your enterprise. The challenge that people, I think have with this is not systematically studying success cases. So just finding something and showing it is a very common, practice to funders and so forth, and sort of emotional pleas about how, a couple of your participants have changed their lives and so forth. What I'm suggesting, though, is a more systematic approach to that, and there are now a number of sort of methods that are used to, to systematically find what's possible with your enterprises or your interventions.
Thank you. This is a question to whoever want to pick up. Who are usually the buyers of evaluation services, and are evaluation reports used for funding purposes?
Our evaluation is for funding purposes.
Yeah, sorry.
Go ahead.
I was just going to say, within the nonprofit sector, certainly, right? So a lot of the reason that that organizations come to us for the sorts of evaluation that we offer is because there have been some really high-profile examples of nonprofits who have come out with really rigorous evidence of program impact, and we're able to leverage that to get funding, typically from the philanthropic community, to scale up their programs pretty significantly. So I think that is, transparently the primary driver actually for a lot of the organizations that we work with.
Yeah, I would say in my practice, my client is often government or a nonprofit organization, but part of the goal is to understand how to deploy resources, acquire resources, redirect resources. So although it's not my primary goal, that's part of what the information is being used to do.
I'll add a different perspective. There's a big growing part of evaluation practice where evaluation is used to learn and develop organizations, projects, enterprises, and so forth. The most notable phrase of a new approach is developmental evaluation, where you're developing evaluative thinking and trying to use evidence in a much quicker way to help you become successful. So evaluation is actually thought of in this as part of the impact. If you have a good evaluation system, which is not a randomized trial, but a different kind of way of gathering evidence, that can be part of your intervention, your enterprise, and so forth. And I think that's one of the most exciting areas and useful areas that we do work in.
I would just say, thank goodness, right? Like, thank goodness we're putting our resources towards the practices or organizations that are most effective. As it relates, we're in a different position, but companies do use our evaluation tool, or more importantly, impact investors will use our evaluation tool to roll up the impact of their funds. I think that's really important. I'm glad that they do.
Carmelo, can you speak to scalability of big data uses in policy intervention?
Sure. So I think, I think we are still, I think, trying to push the frontier of how to use government administrative data and that type of big data to inform policy and understand program impact. So I mean, certainly, as I mentioned earlier, you can use labor market data to understand whether or not someone was able to get a job because of their job experience over the summer. And so that using it to do outcomes measurement is something we'll continue to do. But we've also been engaging organizations and policymakers increasingly in leveraging the data that they have access to in a way that's more analogous to what Netflix does or Google does with the data that they have access to. So actually use sophisticated machine learning techniques to try to identify people who might be most likely to experience a negative event in their lives or most likely to benefit from a program or policy. So for example, you could imagine, this is actually a conversation that we're having with the County of Los Angeles, using data on who's receiving mental health services, who's being discharged from an ER, who's being evicted by the county sheriff, to try to understand who is most likely to end up homeless, and to maybe think about offering them some additional support when they have that experience that brings them into contact with the county mental health system. So I think there are actually a lot of ways in which the government could be getting a lot more out of their data and could be thinking about targeting programs more effectively or to maximize the social return on investment. That's very different than what we do in sort of our RCT work, but I think it's something that we're really excited about exploring. There are a lot of challenges in doing that too. So I think most government actors don't have that kind of analytic capability in-house, and one might argue that it doesn't make sense for them to have it because they will use it so rarely, right? So you have to find an external partner who's able to provide that. There's also just silos within government. So the county mental health department doesn't want to share their data with the county sheriff. But that's where I think, maybe if we can get them both to trust us, then perhaps we can do something interesting. So I think there's actually, the government has a long way to go to catch up with the private sector in terms of how it uses the data that it has. And there are some barriers that need to be overcome, but I think it's an exciting frontier.
Thank you. Stuart, how do you measure externality, positive or negative?
I'm not sure I understand. Externality, let's see, help me with...
Like unintended consequences.
Oh, okay. Got it, thank you. I hope that's what the question was.
I'm
Good,
assuming
thanks.
external
Yeah.
effects.
Yeah, haven't heard that word used for that. What we, and again, I think point I tried to make earlier is when we're at the conceptual level, this is how we should think about impact. When we get down to the practical level, trying to get our sponsors or organizations to seriously go after, negative outcomes is quite a challenging, sort of task. But it's really important to do. So what we try to do with our clients is develop theories of change that are, they're sort of conceptual maps where we look at, what the intended outcomes are, but we go through an exercise to think about what could potentially be some unintended consequences, and if any of those are likely, to be able to develop measures so that we can, check on those. Of course, in the pharmaceutical industry and other those types of evaluations, this is a big part of what they do. I mean, to put a drug out with, unintended side effects that are, very, harmful is really, a bad thing to do in the greater society. Big question for us is, are we putting things that out in society and social areas where we might be able to get a nice outcome, but it's having some really unintended consequences. Robin brought up the issue of inequities. So a very successful program for one group can be damaging to another. So the answer is thinking these issues through very carefully at the theory of change level is how we tend to deal with the unintended consequences.
Thank you. Robin, how do you incorporate results into major resource allocation decisions?
Can you say that again?
How do you incorporate results into major resource allocation decisions?
No, I'm not the decision maker in this case. I'm feeding information into their process. So as Stuart suggests, I spend a lot of time up front asking questions. If I get that information for you, how will you use it? How will it inform particular kinds of decisions? If I find this, will that be something that triggers action for you? If it's not, why should I waste resources getting that piece of information? So I try to spend a lot of time in that upfront process, really working with clients and bringing the community into this process, talking about what it is that we think will be actionable, whether action means resource decisions or action means something else, like changing the nature of how we work together or the kinds of things we're trying to achieve. I mean, obviously, you can't guarantee that people will use the results in the way that they claimed they would at the beginning of the process, and the process won't always go as you planned. So you have to be prepared to be flexible and dynamic and change what you're measuring and have lots of ways of feeding information back in. If all you do is issue a report at the end, you're not going to, I think, achieve a high quality of practice as an evaluator. But that upfront work is critical, and everyone has to be at the table when you do it.
Thank you. Our last question is, for an organization looking to develop new programs, can evaluation precede identification of the specific program concept, or is it the other way around? All of you.
I might
Now
start.
let's let John start that. Yeah.
Because I would say absolutely. There's I think a long tradition and more recently a growing movement towards bringing evaluators in to earlier, having them be part of the design team to help think through how organizations should be structured, how programs should be organized, in part because we bring experience of looking across many organizations. But because we can also bring the tools of evaluative thinking to the early stages of development. So part of a basic notion in design is that you will have to generate multiple options, more than one solution that might work. How do you choose among them? How might you try to gather empirical evidence early on that some are more likely to achieve impact than others? How do you develop a long-term plan in which evaluation not only measures stuff, but is actually promoting that developmental process? So I would say absolutely, and it's where I do that work in my own practice. I feel that we get organizations to a place where they wouldn't be otherwise. They're hitting the road much more prepared to provide an effective product or service.
I would say the other thing that I think evaluators have spent many years developing skills around is really looking very carefully at whether the assumptions you're making are correct, that are informing your thinking about innovation and looking at needs, and also trying to figure out whether what you value is what other people value, particularly the people you intend to benefit. So I think feeding those kinds of pieces of information into the conversation can also be critically important in the early stages of design and throughout, because those are things that change over time.
Yep. One of the points that I'll leave you with is a lot of impact evaluation is done too soon. And that, so in this question, to the extent that we can make a enterprise or a program, proud and get it ready for a good impact evaluation. That's what we want to try to do as evaluators working on the front end. To spend all this money on something that's really not ready yet, is a big waste.
So I'll just echo a couple and reinforce a couple of points that folks have made. I think it's really critical to make sure that you're asking the right question at the right time. So I think thinking about evaluation early in program design, bringing in evaluators early is really important because there might be really small tweaks that you make to the way that you approach your program that will allow you to learn things as you roll it out, as you adapt it over time, right? So the data that you collect on the person that you're providing a service to, if you just collect that in a slightly different way, you might be able to learn something that you wouldn't be able to. On the other hand, though, there is a huge risk in taking on a really expensive, both in time and money, evaluation of something that is still evolving and that you're still trying to improve. I mean, particularly for nonprofit organizations, having a bad evaluation result on a program that actually wasn't fully formed can be deadly, frankly. So I think it's making sure that you're asking the right question at the right time, but I think it is important to at least engage with the topic of evaluation early.
We live within a different context, and so I think it's helpful. So when a company takes the B Corp certification assessment, it's internal, and the assessment is also free. We don't allow a company to certify until I think it's 12 months of operations and 6 months of revenue, because you would be answering our assessment based on aspirations. Like, this is what we hope to pay our workers one day. But we encourage, the assessment is free, and we encourage startups and people conceptualizing businesses to take it because it provides really helpful guardrails for measuring impact. Even folks who are really experienced in measuring impact will probably find across the 5 channels that we measure new things to think about. And how wonderful to be thinking of questions like, oh, I didn't realize that was an important thing to measure. This really relates, and I hadn't considered it before. The assessment provides kind of target opportunities, so you can set where you'd like to be and measure your impact over time. And so it's a really helpful way as you're building a company or looking to scale a company to think about what should we be considering? Who are our stakeholders, and what does that mean?
I just received one more. So when is an outcome ready to be evaluated? And I think, John, you can...
So what was the question?
When is an outcome ready to be evaluated? When is the right time to evaluate an outcome?
So I'm going to probably offer a slightly different perspective than some of the ones you heard here. So people will frequently be nervous about evaluation, right? And they're nervous because they're afraid that what they'll find out isn't everything they hoped for, or that it will have negative consequences in terms of funding. But I think the really smart organizations are engaging in evaluation early to understand their impacts so that they can learn and develop quickly and well. And evaluating for that purpose is different than evaluating to make a public statement that we've achieved some level of success. And it's important to be clear to the outside world where you are in your development. We're starting off, we're still learning, we're here, this is still our beta version, right? Set expectations appropriately. But when you feel that you've gotten to the point where it has some reliability and is likely to be effective, that's when the evaluation starts becoming more externally focused as well, in terms of maybe having an outside person who is objective doing the evaluation, having those evaluation results being reported to the world regardless of what the results are, right? And getting to that place, I think, is important, because if we're trying to really move towards impact, we have to get past being nervous about how that information will affect us. And I think with that, we should probably bring this to a close unless others want to join in. I feel a little bit like I've stolen the last word from the panel. But thank you. Thank you to our panelists.